Good evening, I'm Ian Hannamansing. A tense standoff at a Manitoba church.
So there's no government there that can prohibit us from worshiping God.
Police blocked churchgoers from gathering in one of Canada's worst COVID hotspots.
Take this tow truck away!
The grueling restrictions some migrant farm workers face.
So you've been essentially stuck on that farm for 5 months now?
A Fifth Estate investigation. One side of the street locked down, the other side not.
Somehow it's magically safer on that side.
Businesses struggling to adapt. What if the person breaking into your safety deposit box is the bank?
The reason you have a safety deposit box is for putting things in a very safe place, not to be tampered with.
Why it happens, and the people trying to track down missing valuables. This is The National. The latest tragic milestone, 12,000 COVID-19 deaths in this country. And it's not just the total number that's troubling, it's the rate. Only a month ago, Canada surpassed 10,000 deaths, but since then, the number of people dying each day has nearly tripled. In hospitals and care homes, and for many of the thousands of Canadians getting sick each day, the need to slow the spread couldn't be more clear. And yet tonight, in some of the hardest hit communities, there is stubborn and sometimes angry resistance to COVID restrictions. Manitoba is in an all-out fight to flatten the curve, with hospitals already straining, but new case rates are still sky high. 365 new cases today, some of those infections from one community, Steinbach. As Aaron Broman shows us, it's not just a hotbed of COVID, but also of defiance.
They're not blocking us, they are blocking God.
The RCMP block a van full of parishioners from entering the church parking lot. The police are upholding health orders. Members of the congregation are holding up traffic.
So there's no government there that can prohibit us from worshiping God.
Minister Tobias Thiessen was fined thousands of dollars last weekend. He held an in-person service against public health orders. Today, the plan was a drive-through radio service. That too against the rules. Only virtual services are allowed.
We're proud to stand for religious freedom. These people have to go to church. Let them go. Take this tow truck away. Let this car go to church.
But Thiessen's sermon was interrupted when RCMP sent in the tow truck, prompting him to join the front lines.
You're big time interfering with God right now, not just with us.
People should have a right to choose, wear mask or not wear the mask. You see, go to church or stay at home. That's called freedom of choice.
Let these people go to church. This is wrong.
It became a standoff, but after protest and prayer, victory.
I mean, if we can park in a Tim Hortons drive-through and wait in line, and we're safe to do that, then we should be safe to, anyone should be safe to come to a drive-in event.
Manitoba's COVID-19 case counts have been in the hundreds daily for more than a month. Hospitals are stretched to capacity. RCMP say public health orders aren't about restricting freedom, but ensuring safety. Heading into the weekend, the province's top doctor was clear.
We can't have any gatherings. That includes faith-based gatherings or any gatherings of that nature.
The public health is not ordering anybody here today.
Thiessen finished his sermon from the back of the truck.
Being alone at home and watching a virtual service does not replace worship.
And Aaron, dealing with a scene like that, how did police try to diffuse the situation?
Well, it was definitely tense, but it wasn't violent. And when all was said and done, RCMP said that most people ended up following their orders, except for one man. He was fined $1,300. 125 other people went home. The church says they hope to resume with a drive-in service next Sunday. Ian?
Aaron Broman in Winnipeg tonight. Thank you. In British Columbia, at least one church was fined today for defying public health orders and holding in-person worship services. Those who attended say they're protecting their rights and society.
The church is the community for many people. To many people, it's their only family.
And this church in Langley, BC, was fined $2,300 by bylaw officers. Police were called in. The RCMP also visiting another in Chilliwack as a service was underway there. Dr. Bonnie Henry suspended all in-person faith gatherings earlier this month in an attempt to get the COVID spread under control. More than 24 people were fined thousands of dollars last night in Mississauga, Ontario, after police were called to a house party.
Numerous partygoers fled the area, hopping fences and damaging property in the area. But we were left with approximately 29 people who remained at the party and were dealt with by officers.
Police say the party was held in an Airbnb rental in this area, originally with about 60 people, breaking public health rules. 27 guests were fined $880 each. 2 organizers received summons that could land them fines of at least $10,000. This weekend, hundreds of demonstrators gathered in Calgary to protest new public health measures.
This has been perpetuated based on a fraud.
My faith is shaken in the established narrative.
People need to be shocked out of their lethargic indifference.
Signs for the U.S. president were there, along with others depicting COVID-19 misinformation. It's called the Walk for Freedom, and it's become a weekly event in Calgary. But this was the first time since the province announced a 10-person limit on outdoor gatherings. Alberta reported 1,631 cases today after a record-breaking Saturday. It now has the highest provincial rate of new cases per capita. Let's check in with Dr. Lenora Saxinger, an infectious disease specialist in Edmonton. And Dr. Saxinger, as we see the case numbers spiking in Alberta, what are you seeing inside hospitals?
Well, most of our major hospitals have started to open up additional COVID wards, which means we're trying to find other places for other patients and open up specialized wards with, all the extra precautions in place. The intensive care units are full and expanding into other areas. But it actually looks very strangely quiet because we are limiting visitors and any non-essential people are not present in the hospital. So it's a very mixed scenario right now.
There was an anti-mask protest in Calgary yesterday. I don't know how much contact you have with COVID skeptics, but how do you deal with that?
It's very difficult. It's disheartening, and I think it tells me that the misinformation is very, very pervasive for some groups of people. And people don't necessarily like to change their minds when most of the information they get is a particular kind. So I have had occasionally a little bit of success with asking people for resources that I can actually work through with them to point out where the difficulties are and provide better information. But it's very challenging, and it's kind of disheartening too.
We have just a few seconds left, but if things continue at their current pace in Alberta, what's the next month going to look like in hospitals?
In hospitals will be very difficult. We're already seeing difficulties with providing the type of care we'd like to for surgical care, and we're going to be shutting down more surgeries, and we won't be able to accept complex patients as much in the larger centers. And we are actually looking at places that we might be able to expand for additional beds. So I would call it extremely serious. And I don't think anyone in healthcare thinks it's going to be much of a holiday season, honestly.
All right, Dr. Saxinger, thank you. In Quebec today, 1,395 new cases were reported, and over the weekend, another distinction. Quebec's death toll from COVID-19 exceeding the 7,000 mark. Quebec accounts for 38% of Canada's total cases, but 58% of all deaths. Most are linked to long-term care homes. One home near Montreal is temporarily closing its so-called hot zone, the part of the building housing COVID patients. It's to try to break the cycle of infection after families of residents made a public display of their anger. Valeria Corey-Minocchio shows us the result.
Ambulances come and go in a bid to contain the outbreak at the Maimonides Geriatric Center.
We think it's the safest way to treat the situation. If we want to cut very drastically the contamination of the floor.
Paramedics are bringing 20 COVID-19 patients to hospital. Orderlies and nurses that cared for them will also go. 10 other residents who were infected are recovering and will stay behind.
I love you too, Daddy. Bye.
Some family members say the home's management didn't learn from the first wave in the spring when 39 residents died.
I'm sorry, they failed. They failed because we are here again.
The local health authority calls this a preventative measure and says the outbreak could lead to a public health recommendation that COVID patients not be grouped together in small spaces.
We think that if we put too many acute cases together in the same area on one floor, it is possible that the ventilation is not strong enough to ventilate properly the floor.
Moving COVID-19 patients off-site is the right call, say many residents and families, but more work remains.
Infection prevention, mandatory staff testing, and staffing levels. Those are the three main issues.
I felt from the beginning that the staffing was inadequate, and it still is, COVID or no COVID.
In the second wave, 10 people have died of COVID-19 at Maimonides, and about a dozen staff members have also tested positive as a result of this outbreak. In a nearby region, another home has also been transferring out COVID-positive residents, an approach they hope will make a difference. Valeria Corey-Minocchio, CBC News, Montreal.
Canada's biggest province had today's largest case count, in raw numbers at least. Ontario recording 1,708 new cases of COVID-19 and 24 more deaths. The bulk of those cases still in Peel region and Toronto, the province's COVID hotspots. But there certainly is COVID elsewhere in Ontario, and small farming communities are no exception. An investigation by CBC's The Fifth Estate has revealed hundreds of migrant farm workers were essentially locked down 24/7 on the farms that hired them. The owners were trying to stop the spread of COVID-19. And Mark Kelly found that even after the federal government warned the lockdowns were illegal, some farmers kept them in place.
They're essential workers who come to Canada each year. Tens of thousands of migrant farm workers who plant, pick and pack much of the produce we find in our grocery stores. But this season was like no other.
30 temporary workers have tested positive.
After COVID-19 outbreaks tore through farms and greenhouses this spring in Ontario, killing 3 workers, infecting 1,400 more, farmers took matters into their own hands. We obtained a list of 11 farms where hundreds of migrant workers were told they can't leave the properties where they work.
Mentally, physically, emotionally frustrated.
We're protecting the identity of this worker to help protect his job.
So you've been essentially stuck on that farm for 5 months now?
Yeah, I feel honestly, I feel like I'm in prison.
What's worse, workers on this farm were told by the farmer if they left the property without permission, law enforcement might be called and they could be fined up to $1 million.
I don't know where that idea comes from, that you would be able to restrict somebody in that way. Once they have gone through quarantine, they are to be treated as any other Canadian with the same rights as any other Canadian.
Komianski Farms wouldn't comment, but the federal government told the farmers in an email they don't have the right to limit the free movement of the workers. But with pressure to feed Canadians during a pandemic and the huge costs associated with a shutdown due to an outbreak, farmers say keeping the workers safe simply makes sense.
At the end of the day, we're feeding people, right? What's wrong with that? Are you really worried about how it gets done?
As the season wraps up, news now that hundreds of workers from Trinidad are stranded in Canada. Their borders closed due to the pandemic. A bitter end to a bitter harvest. Mark Kelly, CBC News, Simcoe, Ontario.
Let's look at something more hopeful now. A potential solution to one COVID challenge, how to spot outbreaks sooner, especially at a high-risk place like a long-term care home. Ashley Burke shows us how sewage may hold answers.
Most COVID tests involve a swab going up your nose, but these researchers are looking at what goes down your drain, studying wastewater samples. Science they'll soon be using to try and help the most vulnerable.
It could catch an early signal, so it could be like a smoke detector signal that things are starting to come online, things or outbreaks are happening.
His team is getting their samples from this wastewater facility. It's allowed them to monitor COVID-19 levels daily from over 910,000 people in Ottawa and detected an early outbreak days before it showed up through regular swab testing.
We all go to the toilet, whether you have COVID or not, whether you're symptomatic or not. And so it's a way of doing a survey or census on everyone every day.
Labs in 6 provinces are doing the same kind of work, but one of the pitfalls, the testing doesn't pinpoint the locations where outbreaks are flaring up.
Now the University of Ottawa, along with several other universities, are getting government support to zero in on hotspots, starting with long-term care homes.
88% of people who have died from COVID so far have been residents of long-term care homes. So this would be an opportunity to try to limit that outcome.
Public health officials say tapping into the sewers attached to long-term care homes like this could help catch outbreaks early, in between the mandatory testing every week or two. It could also help conserve testing resources.
It will be a way of monitoring the outbreak within a facility and knowing when it actually has stopped. And so it will offload some of those individual testing resources that we do, ideally.
Testing resources that are sorely needed during the second wave, with a vaccine still months away. Ashley Burke, CBC News, Ottawa.
Let's turn now to the growing debate over Canada's vaccine procurement. The opposition accusing the Liberal government of letting Canada fall behind other countries. Well, today, Rosemary Barton put that to the head of Moderna, which has already sold Canada 20 million doses.
There was a lot of political rhetoric here this week about Canada being at the back of the line. What is your assessment of that statement?
I think that Canada is not at the back of the line, but I can imagine that just like in the U.S. and everywhere else, this is a topic that will constantly be the source of political debate.
And Conservative leader Erin O'Toole seemed more than happy to keep that debate alive today. At a short news conference ahead of tomorrow's fiscal update, he again said that Canada will have to wait for other countries to get theirs first.
Canada is behind the United States, the UK, the European Union, Mexico, Brazil, India, and Indonesia. Is 1/3 of the population of the planet ahead in line for a vaccine?
The opposition leader also cast doubt that tomorrow's fiscal update will do anything substantial to help Canadians even before it comes out.
It will not be a plan for getting Canadians back to work, and it will not be a plan for helping shuttered small businesses stay open.
So a dim view of the Liberal government's performance so far. For their part, the Liberals will do everything they can to convince Canadians the government is on the right track. For a look ahead at tomorrow's update, David Cochran joins us now from Ottawa. And David, what can we expect?
Yeah, we should expect Chrystia Freeland to table a summary of the COVID receipts to this point, all of the emergency spending that's gone out the door, and the cost of the support programs that are ongoing and are going to run until at least next summer. So in July, the deficit was projected at $343 billion. It has grown since then, so expect a projection even higher than that staggering number.
So those are the receipts so far. What about new spending?
Yeah, I think we can put new spending into three broad categories. First, expect new support measures for the hardest hit industries: tourism, hospitality, airlines, help for them in some form. Second, billions of dollars for stimulus and recovery that will roll out after the second wave to try to jolt the economy back to life. Expect investments in green projects, in housing, and in transit. Third, some down payments on big promises. Initial steps on national child care, national pharmacare. Nothing massive, just the beginning, because those are big permanent spending programs that have to wait until a budget and a better sense of what a post-COVID Canada will look like. Ian, what won't be there? A deficit reduction plan. That is also a post-COVID priority for this government.
All right, David, thank you.
Thank you.
And CBC News will have special live coverage of the federal fiscal update tomorrow, starting at 4 p.m. Eastern on CBC News Network and CBC Radio, or watch online at cbcnews.ca. The chief of a Nova Scotia First Nation embroiled in a dispute over Indigenous fishing rights is reviewing a draft agreement with Ottawa.
It seems very close right now. We're very optimistic, and we're happy to get that paper Friday night. And so the next few days is very big for us, and we're looking forward to that.
Sachs says the draft agreement would allow the Mi'kmaq community to sell its lobster catch. Indigenous fishermen launched a self-regulated fishery earlier this fall, and that created tensions with commercial fishermen. For most of us, it's hard to think of a place more secure for valuables than a safety deposit box at a big bank. But as Rosa Marcatelli reveals for Go Public, they may not be as secure as you'd think, and we're not talking about bank robbers.
It's the stuff of Hollywood movies. The bad guys break in and break open safety deposit boxes. But what if it wasn't the bad guys, but the bank that drilled the locks open and emptied them?
I thought the bank wouldn't do that.
Before Sheila Levy-Benchiton's father died, he told her he had cash and jewelry inside his safety deposit box, like the solid gold watch purchased in 1947 her mum is wearing here. But when Levy-Benchiton went to collect the valuables, she discovered TD Canada Trust had drilled the lock open and emptied the box years earlier. The bank said the only things of value inside were a few silver coins it gave her.
The reason you have a safety deposit box is for specifically putting things in a very safe place and not to be tampered with.
TD tells Go Public her safety deposit box was accidentally opened when the bank drilled the locks on 16,000 boxes across Canada to deal with the ones where rent was way overdue or keys were lost. It says the contents were set aside for safekeeping. But are they always? Saraz Katiwada says that didn't happen in his case. TD wrongly opened his safety deposit box. His wife's 22-karat gold wedding jewelry from Nepal went missing.
You cannot replace it. Once it is gone, it's gone.
So why is it so complicated? Safety deposit boxes are largely unregulated by government and the contents are not insured by banks. That can leave consumers at the mercy of the bank's rules, having to fight for compensation when things go missing. Experts say the government needs to change that.
The banks should not be allowed to run safety deposit boxes as kind of a side business.
Unlike the movies, this story has no ending. Katiwada eventually got compensation, but says it doesn't cover all his losses. Levy-Benchiton turned her settlement down for the same reason. She's now considering legal action. Rosa Marcatelli, CBC News, Go Public.
If you want to go public, email Rosa and her team at gopublic@cbcnews.ca. Some Toronto business owners are getting fed up with what they call a lockdown double standard.
The fact that you can line up in Costco and buy all the same things that we're selling, it's infuriating.
Up next, the calls for the Premier to change the rules. Plus, keeping COVID off campus.
We walk into the testing center, we use hand sanitizer, and we go up to one of the stations.
The U.S. University mandating twice-weekly testing. Could it work here? And what is this? How did it get there and where did it go? The mystery of the Utah monolith. We're back right after this.
Now it's time for us to think collectively rather than individualistically. Think about not yourself wearing the mask. Think about the cancer patient in front of you or the person sitting next to you on the bus who could be immunocompromised despite their young age. Think about protecting them.
That message today from a Toronto emergency room physician urging people not to let their guards down as she tries to combat both COVID and COVID fatigue.
I'm seeing people think that their sore throat, their runny nose is the exception. Well, this is the bronchitis I get every year, doctor. This bronchitis could still be COVID.
The brutality of this virus evident not only in the number of lives lost, but in how they're taken.
This is a lonely disease. It is lonely to say goodbye to your family members through a video chat. I've seen it. I've been the one to hand the patient the phone, and you do not want this for your loved ones.
In an attempt to control the virus, Ontario has locked down 2 areas, Toronto and Peel region. But as Natalie Collada explains, many small business owners say the rules favor big box stores over theirs.
2 months after opening her Toronto flower shop, Shannon Whalen's doors are locked. Her business, considered non-essential, became online only when the city went into lockdown a week ago. But big box stores that sell essentials remain open for in-person shopping, lineups and all.
The fact that you can line up in Costco and buy all the same things that we're selling, it's infuriating.
The Canadian Federation of Independent Business thinks so too.
They're basically taking customers out of near empty small businesses and pushing them into big snaky lines at big box stores.
Last week, it sent Ontario's government a list of ideas for how to allow small businesses to reopen safely amid lockdown measures in Toronto and Peel region, worried many won't survive if they can't.
We're saying give us 3 customers at a time. That should provide loads of room for physical distancing, take the pressure off the big box stores. Other governments around the world have found different solutions than the one that is being used in Ontario.
Manitoba's partial lockdown rules allow only essential items like food, winter clothing, and pharmaceuticals to be bought in store. Asked today if Ontario would consider making a similar change, the province's Ministry of Health would only say, "We continue to closely monitor the evolving situation to advise if and when public health measures need to be adjusted." Meanwhile, thousands of businesses like Whalen's in Ontario's lockdown regions continue to make adjustments of their own.
It feels like we're being unfairly targeted and unfairly punished. I mean, small businesses are so important to Canada. They're so important to our economic landscape in Canada.
Natalie Collada, CBC News, Toronto.
Just north of Toronto is York Region, and running along the border of both is a single road that right now also straddles 2 different COVID restriction zones. Katie Nicholson takes us to the divide along Steeles Avenue.
Steeles Avenue isn't just a busy road. It's a border between 2 municipal regions and 2 COVID restriction zones.
Somehow it's magically safer on that side than over here.
On the Toronto side, total lockdown. On the York side, business not quite as usual, but still bustling.
It hurts looking across the street and seeing that mall fully open and stores the same size as my store, having people be able to walk into it and me having to sell my stuff outside.
Daryl Spears has taken a 30% cut in sales since Toronto's lockdown came into effect. He's selling comics curbside, but he's losing out on browsers.
Hey man, thank you. Be well. A lot of my business is a visual business. So you need to be able to walk around and look at stuff, and I'm going to lose all of that. Online works, but online only works to a degree.
On the other side of the street, a different reality.
We have customers that come in, they think that we're closed because they don't realize that just north of Steeles, everybody across the street, Center Point, they are closed. But there's a McDonald's on this side that is open, so it's super confusing because it's practically the same thing. So it is very strange, and it's honestly, it's sad.
Steeles Avenue runs along some of Ontario's worst-hit neighborhoods, but the invisible lockdown line that runs along it can be crossed by anyone. And there are worries holiday shopping Torontonians are going to bring more than their wallets. They might also bring COVID.
The numbers are going to go up a little bit. I mean, it's inevitable, right? If you have that many people coming over here, I mean, it's going to happen.
But York Region says as long as people follow the rules, it hopes to avoid the fate of Toronto's side of the street. And so far, the infection rate data is on its side.
The steepness of it isn't as steep as it used to be. And we have also found a reduction in our new hospitalizations.
So 110.40 is your total.
Good news for this cigar store, while this comic store braces for more tough days ahead. Katie Nicholson, CBC News, Toronto.
When we come back, we'll take you to the Ivy League school where some students take 2 tests a week.
You do 10-second circular motion on each nostril.
So we're talking COVID tests, the $12 million solution keeping COVID off the Cornell campus. What lessons might Canadian institutions learn? Next.
We're entering into what's really a precarious situation because we're in the middle of a steep slope.
During this Thanksgiving weekend south of the border, the U.S. passed another threshold. 4 million cases of COVID-19 reported in the month of November. That's more than double the record set just in October. We hear a lot about how high COVID infection and death rates are in the United States, but there are also success stories in that country that could be lessons for Canada. Terrence McKenna shows us how Cornell University became a model of prevention.
Cornell University in Ithaca, New York is one of the top Ivy League schools in the United States. When students arrive at the beginning of the year, there is a scene that is played out at colleges across North America. Goodbye hugs from anxious parents. Students hurrying to get settled into their unique lifestyle on campus. The emotion of all this was heightened this past September at Cornell by the oppressive presence of a pandemic, according to one of those arriving students, Mariah Adege.
I think there was fear and excitement. I think we had been gone since March, so people were excited to be back and see their friends and things like that. But I think a lot of people at that time, including myself, thought that we would get sent home in 2 weeks and that there would be like some great outbreak and hundreds of students would get COVID. And gratefully that never happened and our numbers stayed low throughout the semester.
The COVID numbers stayed low at Cornell because of an elaborate testing system set up by the university. Starting in September, undergraduate students were tested twice a week, graduate students once a week, the same for faculty and staff depending on how much time they spend on campus.
So we walk into the testing center, we use hand sanitizer, and we go up to one of the stations. So they're all at tables and they have the glass shields protecting us from the person proctoring the test. And then they hand us a swab and we do 10-second circular motion on each nostril, and then we put it in a little vial and it's sent to the testing center. They don't contact you if it's negative, so you only would hear back if it's positive.
A special laboratory was set up at Cornell to handle 50,000 tests a week. In many states and provinces, these tests cost up to about $150 each. Through the economy of scale here, that cost has been reduced to about $15 a test. Samples are pooled and tested 5 at a time, with follow-up only for rare positive ones. Cornell epidemiologist Peter Fraser.
It reduces the number of tests that need to happen and the amount of chemical reagent, the volume of chemicals that need to be used in order to run the tests. So it really saves resources and allows us to run many more tests in a day, roughly 5 times more tests in a day because we're doing pools of size 5 and not many pools test positive.
Now, even those $15 tests add up when you're doing 50,000 a week. Cornell will spend over $12 million on its testing system this year. Worth it, according to Cornell Provost Michael Kotlikoff, a molecular biologist who has studied the virus that causes COVID-19.
Well, SARS-CoV-2 is a virus that when people are infected, upwards to 80% of individuals either never show symptoms or very mild symptoms. So if you're only testing individuals that come in with symptoms, you're testing maybe 20% of the infected population. That means the rest of the population is walking around, they don't know they're infected, and they're transmitting the disease. The answer to that is to test everyone, and to test them frequently enough so that you can detect infection before it's transmitted.
Of course, testing is not the only thing Cornell does to fight the pandemic. Everyone wears a mask on campus, and the students are socially distanced in the libraries, study halls, and in the classrooms.
We sit 6 feet apart and we have assigned seats. And so I feel really safe with that as well. Even if someone were to test positive, I know a friend of mine who was in an in-person class, one of their classmates tested positive and no one in the classroom got COVID, even though someone in the class had tested positive because we're sitting far apart.
When a student tests positive, a rapid contact tracing operation is launched and testing is redoubled.
So if someone in a classroom that's in an in-person classroom tests positive, we'll test everyone else in the classroom, we'll test the faculty, any TAs. If you're in a dorm, we'll test the whole dorm floor. And that allows us very quickly to understand whether there's been transmission and to get those people in isolation if there has been.
Infected students and their close contacts are directed to the Statler Hotel on campus, where they spend about 2 weeks in isolation.
Right now we're operating it as a facility for isolating people that are sick and for quarantining people that have been in close contact with people that are sick. And we have about 150 rooms here in the hotel. We can provide them, food, and we have nurses who are able to keep an eye on them. The health department does a contact trace where they find out where has the student been, whom have they come into contact with over the period when they might have been infectious. And those people are required to quarantine, which usually almost always happens in that same hotel.
When we started this, people talked about universities as sort of landlocked cruise ships where, people would be partying, everything would be going on, you're not going to stop it. And I think, we've demonstrated that students can behave responsibly.
I think there have definitely been some parties that led to outbursts. We've only had 2 so far this semester that led to clusters, but I think that people have been really good about not partying and kind of just doing their social events with less than 10 people and making sure that they're sticking to their pod and socializing with the people that they live with and maybe just a few other people outside of that.
There was bound to be a party that shattered all the good intentions, and it was bound to come from the Greek-lettered fraternities and sororities that are sprinkled around the campus. And that was what happened a few weeks ago with a party at a sorority that infected dozens of people.
We were able to detect it very quickly because we found cases through surveillance, through this regular testing. Then we were able to react to that extremely quickly, where we did contact tracing on the positive cases. We did adaptive testing where we tested all of the people in the fraternities and sororities that were affected. And that was really effective at controlling this cluster.
This testing system has made Cornell the envy of universities in the United States and Canada. It has reduced infections at Cornell by 2/3, from an average of 26 a week before implementation down to 8 today.
So I think there are a lot of lessons that can be learned from the Cornell experience.
Dr. Larissa Matukas teaches at the University of Toronto and is head of microbiology at St. Michael's Hospital. She says Canada has a long way to go on testing.
I think that we have always had the goal of driving the number of tests up and having that capacity available. But it really, at the end of the day, is really quite rudimentary about what we've actually been able to accomplish. And whilst we have done an incredible job, there are still a lot of gaps in our system that fall short of what the Cornell example actually provides us. So we should be having much more targeted testing. We should be identifying cases aggressively. We should be increasing the capacity within our laboratories.
Canada still has no plan for a Cornell-type testing system. Without that, you can't find the vast majority of infected people who have no symptoms and so don't normally show up to be tested. Unless asymptomatic infected cases are screened out, controlling an epidemic is almost impossible. Terence McKenna, CBC News, Toronto.
Getting the facts right is crucial in combating COVID-19, so we want to set the record straight about a story we brought you on Wednesday about vaccine hesitancy and COVID-19. The story included an interview with immunologist Dr. Scott Halperin, who said if 1% of Canadians became severely ill and 0.1% died, that would amount to up to 400,000 people. We recognize the math is wrong. Using his figures and Canada's population, that number would be closer to 40,000 dead. We followed up with the doctor who says he misspoke, he regrets the error, and so do we. Okay, when we come back, a frightening moment on the racetrack. His car was ripped in half, burst into flames, the video of his escape next. But first, some special programming to tell you about. On Tuesday night, a special national event, candid conversations with Canadians from across the country. We've assembled a panel of doctors to address your issues about your health, your community, and your future. Send your questions to covid@cbc.ca and join us on Tuesday night. Adrian and Andrew host Confronting COVID, a national virtual town hall at 8 p.m. Eastern on CBC News Network and CBC Gen. The death of soccer superstar Diego Maradona is now a police investigation. Police dropped in on this man, neurosurgeon Leopoldo Luque, and seized medical records. Prosecutors say they thought the searches were necessary after interviewing the soccer legend's relatives. Luque denied any responsibility in the death. U.S. President-elect Joe Biden is recovering tonight from a hairline fracture in his right foot. He took a spill while playing with one of his dogs this weekend. Biden's office says he'll likely need a walking boot for several weeks. He got a get well tweet from Donald Trump. A fiery moment at a Formula One race in Bahrain as Romain Grosjean's car hit the wall and burst into flames. He wasn't seriously hurt, suffering only minor burns on his hands and ankles. With more migrants than ever landing on British shores, France and the UK have now agreed to double patrols on both sides of the channel. It's hard to overstate the sheer scale of the influx as thousands risk their lives crossing the dangerously choppy water. Renee Filipponi takes a closer look.
The quiet morning calm belies a danger that unfolds all too often on the English Channel. Not far offshore, a border patrol boat scans the horizon. It's looking for this, small boats bursting with migrants crossing from France to the UK. Nearly 8,000 people have made the journey this year, close to 4 times the total of last year.
This has become a very dangerous route into the UK that's being exploited by human smugglers and traffickers.
It became deadly late last month when a boat capsized off the French coast. A Kurdish family of 5 fleeing Iran died.
Now coming across
This former border force chief says the government has vowed to crack down on smugglers.
The UK government's stated intention is to make this route unviable. It will no longer be viable for people to do this, to come via the English Channel in small boats. That's why we are continuing to work very closely with our colleagues on the French side.
Because of the increased numbers this year, hundreds are being housed in facilities like the old military barracks in Folkestone. It was home to Canadian troops during the First World War, where the area served as a staging group for tens of thousands before heading off to fight on the Western Front. Now, more than 100 years on, advocates for migrants say they are run down and overcrowded.
We'd like to see people move to appropriate accommodation. We'd like to see claims being processed really quickly. We'd like to see people arriving who've claimed asylum have the right to work.
Go back! Not everyone in the community agrees, and it's led to tension.
This barrack should be housing our homeless veterans, not illegal immigrants. We don't want you here!
For weeks, protesters have been a disruptive presence, yelling at migrants to go home. Many of the people arriving are desperate and fleeing dangerous conflict zones in places like Iraq, Yemen, and Syria.
I've made it after almost 2 months from leaving Syria.
Ahmed al-Rashid's journey 5 years ago was documented by the BBC. He crossed the channel in the back of a truck organized by smugglers. Today, he recounts just how dangerous it was.
After like 7 hours, we all started to suffocate. It was total darkness, no air, we couldn't see anything.
But he says it was worth it. His family joined him once he was settled. He wants people to understand why so many make the risky journey.
I wanted a place for my children to grow up where when I go to bed, I don't have to worry about them, being bombed or shelled or killed or kidnapped or raped, like what happened in many places in Syria and in Iraq.
Refugees are welcome here!
And it's empathy for stories like his, which drew hundreds to a welcome rally outside the barracks in Folkestone, determined to counter the anti-migrant narrative.
I feel like it's very important to welcome people coming to the country, just to make them feel safe.
A message of support for the dozens of new arrivals waiting to find out if they will be able to call the UK home. Renee Filipponi, CBC News, Folkestone, England.
When we come back, the mystery of the monolith.
So is it solid?
not solid. Sounds a little
Our
bit
moment is next. So last week, a remote corner of Utah became the focus of intense speculation after state officials spotted this shiny metal object, about 3.5 meters tall, embedded in the rock, a complete mystery. Explanations range from experimental art to aliens, but the so-called monolith has made news again by vanishing, and state officials again say they have no idea who's responsible. One of the last people to see it, Utah resident David Serber. His theories about the strange object fuel tonight's moment.
I love adventure, so I paid attention to it. Once you're down in there, You can easily get lost in the slot canyons because they do look very similar to each other. So when I went down there, obviously I had a lot of people write me asking like, hey, is it magnetic? Is it hollow?
All right, y'all wanted the magnet test, so I didn't bring a strong enough one, but not sticking. So is it solid? Not solid.
If it's an artist, they're an extremely patient artist who waited. The Google Earth images show that it's been out there for about 5 years. I believe probably an artist put it out there. There's a campground nearby. Maybe people, came up with an awesome idea of like, hey, let's go put this in a slot canyon and see how long it takes to get discovered. The other positive theory that I like to think is it's a Banksy type thing where the person who built it was extremely patient, knew it would be this big deal, and then it disappears overnight, right? And now it's gone. Obviously, some people removed it. Initially, I got a message from somebody at midnight that I was helping get there. They had told me they saw a truck driving out with something big, but they didn't know it was a monolith, And granted, that's their account.
So obviously somebody put it there, not aliens. Obviously somebody moved it away. And as remote as it is, the Bureau of Land Management apparently doesn't want to reveal where it is. As you heard, it's actually not far from a campground. And just so you know, kind of pull the curtain back for a second, we debated this morning at our news meeting where it sparked a question, what would win in a battle, dragons or helicopters? That's the kind of day we had. That's the National for Sunday, November 29. Good night.